Okay, there it
Yeah,
goes.
do it on the computer. And I'll do it on mine too. Yep.
Great.
All right. Okay. Well, I'm sure other people will join us. That's okay in the next couple of minutes, but I like to try to be that person that keeps us on schedule. So to respect everybody's time, thanks so much for being here today. My name is Ellen Phipps. I'm with Aging Together, and it's a real pleasure to bring this program to you today with Poppy Foddrell. She is a support coordinator with the Aging Services at the CSB, and she's also the VICAP and the SMP. That's the Senior
Medicare Patrol.
Oh, right.
Medicare Patrol coordinator. I couldn't remember that. Of course, the M is Medicare. There you go. We have been doing these monthly educational webinars. It really works best if you all can, if you go ahead and mute yourselves, you will have time to ask questions, but I think the sound quality really works best if you can mute yourselves. If you have questions, we'll take questions at the end, but also feel free to put your questions in the chat and we can read them out for you. So that's not a problem either. So without further ado, I know I've been saying this, but I'll say it again. I am very, very excited about this presentation because I am turning 64 momentarily, and I'm just really excited to learn what I need to do to get my ducks in a row to be ready for Medicare. So I think a lot of people are in the same boat, or at least to help the people that they're serving as well. So Poppy, I'm just going to turn it over to you. Thanks so much.
Awesome. Well, thank you, Ellen and Aging Together for having me, and Pastor Brad, and anybody that's willing to listen, and everybody that's here. I appreciate you for being here. Medicare is a really dry sort of subject, but it's really important that you know the information because they don't make it real easy. And the most important thing I want you to get out of today, if you don't learn anything else, just learn that you can call us at any time for any Medicare questions. We can always help you, or at least guide you in the right way, because so often you don't even know who to call. So just, if nothing else, make sure you know how to reach us and we can hopefully point you in the right direction. My name is Poppy Foddrell, as Ellen stated. I work for Rappahannock Community Services, which is also the area agency on aging. And I'm the support coordinator for aging services in Fauquier County. And I'm also the VICAP and SMP coordinators, which really just means I do all the reporting and the training and things for those programs. And my information is on here. You can reach out to me anytime. There'll be information further on in the presentation regarding all the other ladies that do the same thing at my agency and how to reach them based on the counties. So you'll always have a way to reach us. So VICAP is the Virginia Insurance Counseling and Assistance Program, and it's a program that's funded federally, but it's a federal grant that's provided to all the area agencies on aging throughout the whole United States. And we are here to provide Medicare counseling for anybody that has Medicare, anybody who is working with folks that have Medicare. We do lots of stuff with Medicare. We can help new beneficiaries navigate the Medicare process, explain the rules, the important dates, because the dates and the costs are really important to know. We can compare and enroll beneficiaries in their Part D drug plans and Advantage plans. We help. The biggest time for us is during open enrollment, when we help folks look at the new plans for next year. We can assist with screening and applying for other programs to help pay for your Medicare stuff. We provide information about other insurance options like supplemental plans, long-term care plans. We offer assistance in the Medicare appeals process, and we also educate Medicare beneficiaries in the Medicare fraud and abuse through the Senior Medicare Patrol. So today we're here to talk about all the different parts of Medicare. And as you know, there's technically 4 parts. Part A is the hospital coverage. Part B is doctor coverage. And those two things are going to be on your red, white, and blue card. Part C is the optional advantage plan, and Part D is the drug coverage. So we're going to go through all those different steps. And if I'm going too fast or too slow, please let me know. I probably won't read everything on the slides, but the slides would be available to anybody that wants them afterwards. There's a lot of good information. So if you have questions at any point, you can always call, ask, or whatever. So Medicare, what is Medicare? So Medicare is the federal program that provides health insurance for people 65 and older, or for people that receive Social Security disability for 24 months, or for people who have end-stage renal disease, or the Lou Gehrig's disease, ALS. Those folks are also eligible for Medicare. And Medicare is like the largest health insurance coverage in the entire country. Most American citizens who have paid into Medicare through their employment are eligible for Medicare. And usually, Part A is usually a premium-free sort of thing if you've worked your 40 quarters and paid into the Medicare benefit. The Medicare program helps with the cost of the health care. It doesn't cover all of your medical expenses or the cover of most long-term care. And it's administered by CMS, which is also the Center for Medicare and Medicaid Services. So Part A is your hospital insurance, and that's the one generally, it covers your inpatient hospital stay, skilled nursing care after you go to the hospital, home health care, and hospice care. And one thing I've really learned doing this is if you're in the hospital and you spend the night, it does not necessarily mean you've been admitted to the hospital. So it is so important for folks on Medicare to know, are you an inpatient or an outpatient? If you're an outpatient, they are supposed to at the hospital give you a paper called MOON. I forget what it's called. I should have written it down, but it's called a MOON paper, and it's about observation and outpatient services, because it's really important to know how you're going to cover these things. And as we go through, I'll show you more why it's important to know that. Medicare Part A is generally premium free if you have worked your 40 quarters, which is 10 years of covered employment, and paid into the Medicare program. If you haven't, this little slide just shows you how much it could cost, and it's expensive. Part A is really expensive if you haven't worked into, haven't paid into the system yet. And also Medicare Part A has the highest deductible. So you'll see right here, the $1,484 deductible, that is for inpatient hospital stay. So if you're admitted to the hospital for 1 day or 60 days under Medicare, that $1,484 is what you're going to be billed, that deductible. And then if you're there longer, this shows you will be $371 per day or $742 per day. And after 150 days in the hospital, prayerfully, nobody's in the hospital that long. But if you are, you're then responsible to pay all costs. And with the skilled nursing facility, if you are admitted to a hospital and you have 3 days admitted to a hospital, you qualify for the first 20 days under Medicare, for Medicare to cover those first 20 days in skilled nursing for you. There is a 3-day period, but because of COVID, I believe it's been relaxed a little bit. But that first 20 days is really important. After those 20 days in the nursing facility, if you're doing rehab and the facility believes you're getting better and they can prove to Medicare you're getting better, then Medicare will continue to pay part of it, and you'll be responsible for the $185.50 per day. But after 100 days, you're going to be responsible for the whole thing. And if you're not getting better under skilled nursing in the first 20 days, then Medicare won't pay for it either. So it really depends on how you're progressing in rehab. Part B is the medical insurance, and that covers pretty much everything else as far as doctor stuff, doctor visits, outpatient hospital services, any medical equipment that you're going to need, home health care, x-rays and lab services, mental health services, any drugs or medicines that you get at your doctor's office, or if you get it in an infusion center, those are going to be covered under your Part B. And your preventative Welcome to Medicare visit is covered under there. And Part B's costs are different. Part B is the one that you're going to pay for. You're going to have a premium every month. And if you get Social Security, they're going to automatically take that premium out for you. And the monthly base premium this year is $148.50. But of course, it's based on your taxable income from 2 years ago. So it's not cheap, but it is, that's what they're going to take out for you. If you are not receiving Social Security, they will bill you, and you can usually pay it quarterly. And now through the Medicare.gov website, you can pay your premiums that way as well. Part B has an annual deductible of $203. And with Medicare, once you have paid that $203, that's when sort of it tells Medicare, okay, now Medicare is going to pay 80% of all Medicare approved charges, and then you'll be responsible for the 20% that's left over as soon as you pay that annual deductible. And this chart here just shows you the differences in prices. They can charge you more based on your income for your Medicare Part B. So people who are single and are making $88,000 or less, or married $176,000 or less, you're going to pay the base premium, the $148.50. But if you make more money, or if you made more money 2 years ago, they're going to charge you more based on your income. And you'll see here, these numbers in green are what your cost would be instead of the $148.50, depending upon your income. So the most that anybody could ever be charged is $504.90 per month per person. And that's based on your income. And when you retire, most people, of course, get Medicare and they're retiring. And so Social Security does have some, not leeway, but they have some exemptions for you if you contact them and you tell them, my income is not what it was, or if you fall under their criteria, they can change that premium for you as long as you follow their forms and fill them out and send them to them. It's crazy because Social Security is in charge of governing Medicare, and they know nothing about Medicare. They only know when people should be eligible for Medicare. They only know what your premium should be. Other than that, they really are supposed to forward any questions they get to one of us, SHIP counselors or whatever, because they really don't know a whole lot. So you don't want to ask them any questions really, but they can tell you how much they're going to charge you. And you have to apply through Social Security to get Medicare. So there are some services that are not covered by Medicare. Long-term care, nursing facility coverage, or even in your home is not covered under Medicare. Routine dental indentures are not covered. Routine vision care, unless you have glaucoma, diabetes, anything medically necessary, that can be covered under Medicare if you meet those requirements. No glasses or contacts unless you have cataract surgery, then they can help you buy your first glasses after that. They won't cover cosmetic surgery, acupuncture, or hearing aids, or exams and fittings. So the whole thing about enrolling in Medicare is completely different to everybody. And this is the thing that has changed most, in my opinion. It used to be every single person, when you turn 65, Social Security was going to send you out your Medicare cards. You're going to have it. And then what they realize is most people are still working longer and longer. And so they've been sending back those cards because they don't need them. They already have a group health coverage. So only the people who are currently receiving Social Security benefits, whether it be at 65 or if you've been disabled by Social Security and you've received 24 consecutive months of Social Security disability payments, those are the only people that are automatically enrolled in Medicare. If you want to apply, you can start applying at 65, and you have an initial enrollment period. Everybody gets an initial enrollment period, and that is when you turn 65, the 3 months before your 65th birthday, the month of, or 3 months after. That's when you can apply for Medicare. I would say, especially now with COVID, the earlier you start, the better. They'll only let you start, but so early. But if you want to enroll, I would contact Social Security sooner rather than later. And they have made it a lot easier through the website. You can fax your forms in. So the initial enrollment period still, though, is around your 65th birthday. What else? If you are working and you plan to continue working after age 65 and you have group health coverage through yours or your spouse's current employment, you can delay enrolling in your Part B coverage and you'll get a special enrollment period. So as long as you have group health coverage, you can apply for Medicare while you're still covered. They even give you up to 8 months after you lose that covered employment to enroll. But one thing I learned very early on is they don't look at COBRA as group health coverage, even though it's the same coverage and more expensive coverage. So if you have COBRA, make sure you enroll as soon as possible when you leave your employment. If you miss your initial enrollment period or your special enrollment period, there is a general enrollment period, which is every year, January 1st through March 31st. When you apply then, your benefits don't start till July 1st. So sometimes a late enrollment penalty can apply, and you can be charged a late enrollment penalty if you don't enroll in your Medicare benefits when you need it. Like when you're 65, let's say you're 65 and you don't have any other group health coverage, that's when you need to apply for Medicare. And with Part B Medicare, and what it is Part B, you'd be penalized for not enrolling in Part B. And so that penalty is like a 10% charge for every year you don't have coverage. So they make it easy as far as applying January through March, but your benefits won't start till July. So you also don't have coverage until July. So it is really important to know when you need to apply. And you can always call us. We can sort of help you go through the scenarios. The good thing is I get more and more calls now for people turning 65 or getting ready to retire. And so I'm grateful that people know to call us so they know what they should be doing, because Medicare will penalize you in a heartbeat. So this little slide just tells you more about your enrollment periods. Most people are going to apply, well, not most, but people can apply during their 65th birthday, 3 months before, 3 months after. The open enrollment period is not for Medicare A and B. It is only for the drug plans and the Advantage plans. Then you have the general enrollment period and the special enrollment period. So everybody's coverage is going to start at a different time. Don't listen to what your neighbor or your cousin or your grandma did, because everything has changed. So definitely get in contact with us if you have questions. Medicare will send out that Medicare New Book, and that is the way that they cover themselves, because all the rules and things are in there. You have to decipher them, but they're there. So, call if you have questions. So the Medicare Part B, C, or the Advantage plans, to get one of these, you have to already be enrolled in Part A and Part B. And you have to live in the plan service area. These are the Advantage plans that are based on where you live, and they do cover all the same benefits and services that you would have under your Part A and your Part B. But this plan is going to replace those benefits with whatever company you choose, whatever insurance company you use. You're going to be enrolled in that plan's coverage. So if you go to the doctor and you have an Advantage plan, make sure you tell them, I have an Advantage plan, not a Medicare plan, so they can make sure that they know, so that you know that they're going to cover your stay there. All providers do not accept Advantage plans. The benefits, costs, and co-payments and premiums are definitely different depending upon the plan. They are also approved and managed by Medicare. They are approved companies that they follow the rules set by Medicare. But if they don't follow the rules, then Medicare can penalize them and put sanctions upon them until they do. And if they don't, then their plan will not be allowed to be offered through the Medicare.gov website, through the Plan Finder. And that's the best place to go to look at any of these plans, is the Plan Finder. These plans, most of them include prescription coverage, but not all of them. And they may provide additional benefits, services such as dental, vision, transportation. I know y'all see all the marketing and all of the commercials on TV about applying and calling these numbers. And of course, in the smallest print possible, it tells you that you're calling an insurance agent. Even in the forms you receive to do surveys, it tells you you're going to be contacted by an insurance agent. One of the seniors members here at the senior center brought me one yesterday, and she said, should I fill this out? And I said, well, do you want to be contacted by the insurance agents or not? And she said, absolutely not. And so I said, well, then you should probably shred it, because they have really unique ways of marketing their things. And I can tell you that all these plans are offering the give back benefit, or the benefit of paying that $148.50 back into your check. I can tell you that I don't believe any of our plans in our 5-county area do that. I think last year we had one in Orange that covered up to $50 of that. But I don't think this year we do. I know in Fauquier we definitely don't. So just so you know, these plans may require only in-network providers or cost more money to go out of network. And I know a lot of these companies say that if you have PPO, you can go see any doctor you want, and you can, as long as you know if they're not in the network, you could be responsible for the entire fee. So make sure you try to go to doctors that are in their network. Copays and deductibles will apply for the doctor visits, hospital stays. Before you choose an Advantage plan, make sure all of your doctors are in the plan's network. These plans change annually. They come and go. They have exploded though through our area. There used to be only 4 plans. Now we have about 18 in Fauquier County alone. So there's lots more coverage. I mean, lots more options with the Advantage plans. So you can always check on your coverage every year during open enrollment, which is October 15th through December 7th. But the Advantage plans get an additional open enrollment window of January 1st through March 31st that you can change those plans to. And then you've got the drug plans, Part D. Now, Medicare requires you to have a drug plan. This is another place where you could be penalized if you don't get one. And they base it on the amount of months that you don't have the plan or a drug plan. If you have, let's say you have retiree coverage through the federal government, which offers a drug plan, that is okay. As long as it is credible to the same coverage that you would get through Medicare, you can have your drug plan in a different form. It doesn't have to be through Part D, but if you don't have retiree coverage that has that, or an Advantage plan, you definitely want to get a Part D plan. Because if you don't enroll, and then you enroll maybe 2-3 years later, when you take some meds, then you're going to be paying more than you're going to probably pay double what your premium would be if you didn't have the penalty. But the drug plans, they cover the cost of the meds. Each plan is different. They each have a formulary. These plans change every year. So if you're enrolled in a drug plan, you're going to get an advance notice towards the end of the year, around August, about what your plan, how it's going to change. The only problem is it's not going to look at all the other options. In the state of Virginia, I believe we have 30 different Part D plans. And so through the plan finder on Medicare.gov, you can log all of your meds in, pick the pharmacy that you want, and it will seamlessly tell you what the best plan is for you. So they've really improved that system over the years, and that's what we would use if you called us. I do really want to emphasize for you, if you have a Part D plan or if you have an Advantage plan, it is so important to look at your plans every year, because these two things change a lot. It might stop covering your drug or something. So you want to make sure that going into the next year, you have what you need. Because if you don't qualify for extra help, you can't change that drug plan until the following year. So it is so important. And you can call us. We, through open enrollment, always, it is our busiest time of the year, and we love to help people do this. We have saved people hundreds of thousands of dollars by switching plans, or sometimes just switching the pharmacies, because these plans sometimes will have 1 year, it'll be one preferred pharmacy, and the next year it'll be different. Some pharmacies are completely out of the plan's network. So it is really important to check that every year. And the coverage is definitely person specific. So it is based on what you're taking, what pharmacy you use. It does not benefit you to have the same plan as your spouse, because it's not going to give you any discount unless it's the best plan for you economically. So I'm sure most people hear about the donut hole or the coverage gap. So I wanted to include a slide about this. It's not going to be sufficient to explain what it means, but if you have really expensive medicines, like if you like all these new meds that are on TV, any insulins, breathing medicines, those folks generally enter into the donut hole, and you get into the donut hole by you and your plan paying $4,130. And I've seen people in the donut hole and out of the donut hole in January because their meds are so expensive. So when you're in the donut hole, the cost of your medicines go up tremendously. You are then responsible to pay 25% of the brand name cost of your medicine. Regardless if it's generic or brand name, you're going to pay 25% of whatever the retail cost is. And it takes a lot longer to get out of the donut hole than it does to get in it, because then you're responsible to pay $6,350 to get out of there. Only your money is counted at that point. Then you can be in the catastrophic coverage and you'll only pay small costs at that point. So the donut hole is terrifying, but it's better, and it's better than it ever was. It used to be you'd have to pay 75% of the brand name cost, so it's gotten a lot better. So Medicare, how it works, once you have your Medicare benefits, your A and your B, you then have to decide how you want to use your benefits. So you have different options. You can have your Part A, your Part B, and a drug plan. You can have your Part A, your Part B, a drug plan, and a supplemental plan, which we'll talk about, or you can get an Advantage plan. But again, you have to have your A and your B to get your Advantage plan. So and everybody is, it's everybody's prerogative to go whichever way you want. Depends on how you want to pay for your services. But you can always call us when you have other questions. So original Medicare, it includes, of course, the Part A and the Part B. You also have to make sure if you're on original Medicare that your providers accept Medicare assignment. And your original Medicare, the red, white, and blue card, is portable throughout the entire United States. So you can use it anywhere. It's not based on a network. You can go to any doctors that accept Medicare assignment. Once you use your benefits, you're going to pay for services as you get them. You're going to have a deductible, like I said, the $203. So if you only have original Medicare, you're going to go to the doctor. Doctor's going to bill you. Once you reach the $203, Medicare is then going to start paying 80% of all of your services, as long as they're Medicare approved, and you'll be responsible for the 20% left over. If you want drug coverage, you can add a separate drug plan. It pays for much, but not all of the cost of your covered medical health services and supplies. So you can buy a supplemental policy that can cover those things that Medicare doesn't. And some Medigap policies also cover some services that wouldn't be covered if you were out of the country under original Medicare. So a lot of people like that option, but really you're only going to get emergency treatment either way. So the supplement, or the Medigap plan, is an insurance meant to supplement your original A and B Medicare coverage, but it doesn't replace any part of that coverage. So basically it's a supplement to your current Medicare plan. It pays the deductibles, co-payments, some of the other out of the pocket costs that you might have, and some other extra benefits that Medicare doesn't cover. Medigap insurance is designed to fill some of the gaps in healthcare coverage. And regardless of the policy or the plan you choose, you're going to have a premium. You can pay it annual or monthly for the Medigap coverage, and it's going to vary depending upon the plan that you buy. And everybody who gets Medicare has what's called a guaranteed issue right. So when you are first eligible for Medicare and you have your A and your B and you're 65, you have a 6-month window that these supplemental plans cannot ask you any medical questions. But after that 6-month window ends, you'll go through medical underwriting, and these plans can determine if they want to cover you, if they want to charge you more, or if they don't want to cover you at all. So it's really important to know that 6-month window is not something that you'll ever get back. So it could be when you're 70, when you finally get your Part B coverage, but as long as you have your Part B and you're 65, whenever that Part B starts, that's when you know you have a 6-month window. They can't ask you any questions whatsoever. You also, if you delay enrolling in your Part B, your Medicare, your Medigap automatically, that little open enrollment period will start the month you enroll in your Part B. So it's really important that I've had people call me in their 80s and they want a supplemental plan, and I tell them, and they call me back and they said, no, they wouldn't cover me, or it's $402 they want to charge me because I'm outside of my guaranteed issue right. And Medicare also offers a couple other guaranteed issue right protections other than when you're 65 and your Part B. If you have a plan and your plan goes out of business, let's say you have an Advantage plan and that Advantage plan is no longer sold, you can get a guaranteed issue right for 2 months to buy a supplemental plan if you want to. If you are leaving your covered employment and you have Part B already, but you're older, you get a little 2-month window to do that. So it's just important to know you do have other options, but it's so important to buy one when you can, because they don't have to sell them, because they're just a supplement to the coverage you already have. And you can purchase a Medigap policy through one of the insurance companies or through your most recent employer. Sometimes they offer retiree coverage where you can get, that can become your Medigap plan, and it'll probably also offer drug plans. And we get stuff through the Bureau of Insurance every month now about all the plans, the options. So if you ever need one, we can always send them to you. They are standardized plans, and they're all letters, of course, to make it further confusing with the A and the B already on your Medicare card. There are A plans and B plans, and they are not the same as your A and B on your card. So this is just a little snapshot of the plan offerings, and you'll see G right now is the most comprehensive coverage out of all the options. It used to be F, but F they stopped selling to new Medicare enrollees after January 1st, 2020. So if you had Medicare prior to 2020, you can still buy an F plan if you want to, but any new enrollees, the most comprehensive plan you're going to get is a G plan. And they also offer a high deductible option for those. So again, we can go through it in more detail if you need more help with that. Finally, in the state of Virginia, this year, January 1st, 2021, the state of Virginia is requiring these same insurers to sell Medigap plans to people under 65. I was so excited when I heard that this was going to happen until I realized the plan premiums that they are charging these folks. I learned that these plans are not regulated the same way, and they are extremely expensive, and they do not cover a whole lot. They don't have a lot of options. But because Virginia law now requires it, each insurer has given them the bare bones plan at a really, really high rate. So it's so unfortunate. But if you know folks that have Medicare and they're under 65 and they want to enroll on a supplemental plan, you can definitely have them to call us, because there's they've given folks a new window. If you were prior to this year and you had Social Security disability and you had Medicare, everybody has their guaranteed issue window is until June of this year. So those folks will not have to go through any medical underwriting. After that, they will. The good news is for people under 65 who have Medicare, when you turn 65, you're going to get a brand new window to buy a different plan, hopefully at a much better rate, because these rates are astronomically expensive. I'm just going through these quickly because I'm really running out of time already. It includes, so the new plans, they include 38 companies. There are 76 policies available. They're mostly Plan A, which is not a lot of coverage, and the average premium per year is $5,411, which is like at least 5 times more than you would get if you are somebody 65 and over, because there's no regulatory requirements, unfortunately. It's really sad. So there is help though, if you are lower income or you need extra help to get your prescriptions covered or your drug plan covered. And so there's two ways that you can get extra help. There's the extra help program through Social Security and the Medicare Savings Program, which is through Medicaid. And so extra help, if you're married and your income is below $2,198 for a married couple, and your resources are below $29,520, you could qualify for extra help on your drug plan, which means you could get a smaller premium or maybe a zero premium plan and a lower copay. You'd be responsible for up to $9.20 for any brand name medicines. So it's much better than somebody who would pay the full price for those plans. And then through Medicaid, you have the Medicare savings plans, and the highest income that you can have is down here for, it's a $1,980 for a couple. And what these plans do is they are going to pay your Part B premium for you. These are Medicaid plans that you apply through Social Security. If you have a QMB plan, qualified Medicare beneficiary, that also sort of acts as your supplemental plan to your Medicare benefits. So it's like Medicare's primary, and that QMB coverage can cover those co-pays, deductibles, and the Part B premium. And so SMP, Senior Medicare Patrol, is something else that we also provide information and stuff about, and we always make sure that people know who to contact. The SMP is a phenomenal organization who has recovered millions of dollars just in Medicare and Medicaid fraud, waste, and abuse. So it is so important with your Medicare number. You have to protect your Medicare number, keep your card away from everybody else. Even though with the new numbers, you don't want anybody to have your Medicare card because you don't want them to bill things to you. And then it would look like your medical stuff is different than it really is. You have to detect fraud, errors, and abuse by reading your Medicare summary notice, which is so important to make sure that the coverages that you're being billed for are things that you've actually had done. And you report any questions, mistakes, or anything to your medical provider first. And if you don't like what they've told you, or if you're not satisfied, the number on here is directly to Senior Medicare Patrol. They can do investigations and research to determine if it was actually an error, if it was fraud, how to change it. And so you'll get billed correctly. And these summary notices look like, whoops, wrong way. So you'll get a summary notice. You can get them quarterly. If you get them in the mail, they'll come every 3 months. It'll have all your services, and you just want to make sure all of your providers have billed you correctly. It'll keep track of your deductible for you. It'll tell you if any of your Medicare things have been denied. It's a really important piece of information. If you log in and make a mymedicare.gov account, which I recommend everybody on Medicare do, you can look at your summary notices almost as if they are processed. So it gives you a better idea, tells you how to do appeals and all that stuff. And so other than me, these are all the other beautiful ladies that we all do the same sort of thing here at the Community Services Board. And each, Hannah, me, Tony, Jenny, and Kathy, we all serve different counties. You can call me anytime, of course, but you can call the folks in your county or the county of your beneficiary, and we're always happy to help you. We're not really doing any in-person meetings right now, but we are doing lots of Zoom and lots of FaceTime and, any other way we can get the information out. It is really important for people to know that you have a local contact. This is a beautiful slide that Kathy Walker made. I love this one. And then there's just some information about any other ways that you can reach other organizations that you might need help with. And the most important thing on here is consult with your family, financial and tax advisor, and attorney and insurance counselor to determine the best coverage for your needs, because these plans are very person specific and everybody's is going to look different. So always know you can call us. Any questions? Woo!
Man.
I got through it all.
Wow.
Thank you, Lord. Okay, now I'm trying to figure out how to get back to so I can make my picture.
You stop share. if you stop the share and then click on your little video camera, you'll get your picture back.
Oh, perfect. Okay.
Wow. Well,
Great.
Stop share. Oh. All righty. Any
yeah,
questions?
So first of all, thank you
You're welcome.
so much.
It's a lot of information.
That was a ton of information. My head is kind of spinning.
Yeah, I'm sure.
I'm sure I have a ton of questions, but I'm going to open it up to everybody else first. So, if you have a question, either just go ahead, you can put it in the chat, or just go ahead and unmute yourself and feel free to ask the question of Poppy. And we do have a couple of comments about, how amazing that was, and what great information. So
it's a lot of information in a little bit of time, but at least you have the slides and you know that you can call us anytime, seriously, because we want to make sure that we provide the most education for somebody to make a really good choice. We aren't insurance salespeople. We aren't going to give you our opinions. We're going to give you all the knowledge that you're going to need. We're unbiased, we're free, and we'll do one-on-one conferencing to help you make a really good choice. Because, if you don't make the right choice at the beginning, it's almost like it sets you up to fail from the start.
Mm-hmm.
And if people don't read that book, they don't know anything.
And I think that you really make a good point that, there's someone like you available in every county that we cover. And so, calling you and getting those questions answered, because I can't imagine that people wouldn't have a ton of questions, because there's so many layers to it. We have some questions coming up in the chat.
Okay.
So the first one, when you turn 65, can your employer force you to go off the group plan and take Medicare? Great question, Pastor Brad.
Well, I think yes, they probably can. They can force you to take your Medicare benefits if you want to continue to participate in their coverage, maybe, or I feel like they probably can. I don't know for sure, but I can find out the right answer. But I think they probably can, because they know that you're eligible for it. And, let's be honest, people, as we get older, they think that our insurance needs are going to be higher and more expensive. So yeah, I think they probably can, but I'm going to write that down and get you the right answer.
Well, and I guess something sort of related to that, because you mentioned if you're, like Cobra doesn't really count, but
No.
what if you are, what if you're somebody who's paying for a plan like on the exchange? You're paying out of pocket for a plan on the exchange.
No.
And then you turn 65, you can go right on Medicare.
Yes. So those plans are private insurance companies, and they don't count either as far as group health coverage. So yes, that is, if you have the exchange, like if you have something on there, when you turn 65, that is the best time to start your Medicare benefits. Yes.
Okay.
Poppy, I have a question. My name's
Sure.
Kimberly. Hi.
Hi.
I actually, my mother and I were one of the first VICAP counselors like 20 plus years ago. And I didn't even know it still existed. So I would like to speak with you outside of this conversation about possibly doing that, because I remember I've told people about it. I was like, I don't know if it still exists. And I saw this, I'm like, I gotta listen. I gotta see what's going on.
Yes.
The one thing, I still work for a very large health system, and talking about that employer forcing you, the one thing that I see a lot of, and this is just information, is I see a lot of, it's called an MSPQ, which Poppy, I'm sure you know what that is. It's a Medicare, it's a questionnaire that Medicare asks employees or subscribers to complete to figure out if their commercial insurance should be the one covering. So if they're still working, and if they're the age 65, they're still working, or they have a spouse that's working, usually Medicare will push those commercial plans to be primary. So Medicare will drop as a secondary. So that's just some useful information for anybody. But yeah, I was really excited to, I've been doing this for a long time. And when I saw that, I was like, I went to Richmond and I had a class. I did this.
Yep. Still go to Richmond.
So,
Yes.
yeah, that is so awesome. So if you don't mind, I'd like to be able to just touch base with you and just see.
Call me, email
you
me,
know.
please. Yes.
Okay, I will.
Yes.
I know. So thank you so much. I did this on my work time because again, it's so much information. And I was definitely in the Medicare world for so long. And then I was in a different specialty. And so we didn't see very many Medicare patients. And then I got back to another specialty that's all Medicare. I was like, oh my gosh, I need to listen because so much has changed.
Oh my God. Yeah.
So much has changed, and it changes all the time. And that's what I tell people too. Like you need to know, what's going on because everything always changes. So thank you so very much.
Thank you.
I'll send you an email
Please.
And so this is awesome. Thank
Yay,
you.
nice to meet you. Thank you for
Good to meet you.
Yay.
Hey, Poppy.
Yes.
It's Lisa.
Hi.
And hey, how you doing?
Good.
So I remember that question coming up at another seminar, another Medicare seminar that I was at. And so I did a quick Google search on it, and it says that it's illegal for an employer to force any actively working employee to choose Medicare instead of their group health plan.
There you go.
So,
Wow.
I mean, you might still want to check that out, Poppy, just to confirm, because it is Google. But I do remember that coming up at another seminar, and the answer was that they could not do that.
Wow.
And Lisa, I kind of remember that too a little bit. And that's why I brought up the MSPQ because of the question. It's a really specific questionnaire. And if you have a commercial, Medicare doesn't want to be primary. So
Right,
nobody wants to pay.
No.
Exactly.
Oh my gosh. Never.
You're pushing all these advantage
But
plans.
if you're
Medicare doesn't want to pay.
But if you're working, if you're 65 and you're working and you didn't have a group plan, you had, like I was saying, that private thing, then it would be better for you to do Medicare, and they wouldn't deny you though, right?
No, definitely not.
Okay.
And you can't have an Affordable Care Act plan and Medicare. It's illegal to have both. So yeah, you should definitely enroll because those plans don't work with Medicare. So yes, if you have one of those, you go by your 65th birthday sort of window.
Yeah.
For sure.
Okay.
For sure. Yes. Oh, thank you for Googling, Lisa. Yes. I do know lots of places like, some places will force you to get that if you want to keep your retiree coverage, or like even TRICARE, you have to have an A and B to continue those coverages. So it just depends. And like you said, it's so much information and it changes all the time. I try to keep up, but it's hard. It's a lot of info.
A lot of info.
But it's good. And it's good to know that you have a place to call, like anytime. Please call us.
Not just during open enrollment. You're there
all the time.
round.
Year round. It's one of the services we provide through the Area Agency on Aging. Maybe one day we'll have a little thing about everything else, all the great other things we do there, because we do lots of other great things.
Yes,
But I'm always happy to talk about Medicare because there's so much misinformation. There are so many insurance companies illegally contacting people and telling them the wrong information, sending out things. This year was worse than I've ever seen.
Wow.
People several of the people at the senior center were contacted during open enrollment to enroll in these advantage plans. One of them had retiree coverage. One of them had a great supplemental plan. And oh my gosh, thankfully they told me and they were able to fix it. But it's horrible, the misinformation, and these daggone commercials drive me crazy.
I know.
Probably
I
worse
think of that
during
too.
COVID, right? Don't you think because of COVID things were worse?
I don't know.
It was
probably the scare tactic, like here's an opportunity to take advantage of people who are, are
home and
exactly. And then, oh my gosh, I need this and I need that. So shame on them.
Yes. And one thing I want to say is if you are working and you're trying to determine which, always weigh your costs, because I have a lot of people that call, and some of the insurance when you retire or when you turn a certain age, they do go up, like it's more expensive. So it's always good to weigh your options to see which would be cheaper, whether it's Medicare or your own employee coverage, because sometimes Medicare is cheaper. which is weird, but it could be.
So Kim, I was wondering where Kimberly works now.
I work at Novant for Novant Health,
Okay.
but I'm responsible for Bull Run Family Practice. When I started this, I was working in Warrenton. Like when I did my first VICAP meeting, I was working in Warrenton for Dr. Kenneth Kornetsky. He's a nephrologist, and have stayed in touch with him. But and then I was working for an OBGYN, and we didn't see very many Medicare patients.
Right.
So that's why I was like, well, wait a minute. I need to kind of reconnect with the Medicare crowd, because now I'm
Okay.
seeing a lot more of that. So we didn't see very many patients at the OBGYN office. So, and again, when this popped up, I was just really excited to know that it still was around. And I guess I just didn't think of it because I wasn't working with that population anymore.
Right.
But that's where my heart is. So I wanted to listen and see what information you had to offer, because, you know, whatever I can do to help our patients and get them to where they need to go for help
Oh, please,
is
yes.
everything. You
Dear
know?
God, yes, please tell them to call me. Please.
Yeah, I
please.
absolutely will. So thank you so much. Again, it was a great
Are you familiar
presentation.
with the Aging Together website as well, Kimberly?
I'm not, but I saw something that popped up with your name right there with your name. So I will share that information too.
Yeah.
Because again, I mean, I am working from home, but I'm on the phone with patients. So I'm just trying to navigate, you know, and I have to do my own research, just because again, it's just been a while since I've been in the Medicare mix.
Oh, it's changed. For
Oh
sure.
my gosh.
We work closely with John Carter from Novant. He's the, I guess, marketing.
Oh, okay. I know who he,
Yeah,
I don't
and-
know him, but I know who he is.
Yes, he comes to all of our different meetings and things, and we will set you guys up with a ton of resource guides. We have a really wonderful 90-page resource guide coming out
Okay.
shortly. So we'll
Okay.
make sure you and all the employees there know about
Yeah,
them.
that
to
would
give
be
out to
great. And
seniors.
then, yeah, that would be wonderful, because again, there's just so much information. And I do know, you know, a lot of is expected for maybe somebody who works the front desk. I work behind the scenes, so I have the time, and somebody who's working up front can't
Yeah.
give that information as quickly. And again, I've been doing this for a really long time.
I'm
So-
glad you joined us today,
know, it's
Kimberly.
terrific.
That's
Thank
awesome.
you.
Really
Thank
glad
you.
that, really nice that you were able to join. And yeah, who knows? Maybe you'll end up doing some more VICAP counseling. In your
I
future.
know. I think I might be. I think I want to.
Yeah.
So
Right.
Are there I know it's almost time for us to end today. I just want to make sure that if there were any other questions, you had a chance to ask your question or put one in the chat. Obviously you can always get in touch with Poppy or any of the other counselors in your county. But let's just give it one more opportunity for folks.
Well,
to ask
somebody
any
did ask about
questions.
Poppy's slides, and I checked with her, and she said, yes, we were happy
Great.
to provide those to all of the participants today. So I guess we can email.
yeah.
them.
Excellent. That's great.
Lots of good info in there.
Yes, yeah. Thank you for that. Thank you. Well,
And it always changes, so you can always call. Just call if you have questions anytime.
Thank you.
well, I want to thank everybody for taking the time to be here today, but particularly Poppy for that wonderful presentation. Like I said, so much great information. We really appreciate it, and I think you're going to be getting a lot of calls.
That's
Mhm.
okay.
Just a guess, but I think
It's-
you're going to be getting a lot of calls.
That's okay. That's what we
Um,
want.
Yeah.
Because the more people that call, the more people that know
Get
what
the
they should.
accurate information.
Exactly.
Absolutely. We're not
Yeah.
selling anything. Nothing.
Right. And
Thank God.
That's great. Exactly.
We need to
Exactly.
give our RCS a big budget so they can put good commercials out, right?
Yes,
And we can
exactly.
skip those insurance ones that are always out there.
Oh, please, yeah.
That'd be something.
That'd be great.
Yeah.
I hope you can all get outside for a little bit and get some of this beautiful fresh air and enjoy. And I hope to see you all very soon. So thanks so much for joining us. And
thank
enjoy the
you
rest of
so
your
much.
day.
It was
Okay, bye,
wonderful.
Poppy.
Great job.
Thank
Great
you.
Bye,
job. Thank you.
everybody.
Oh,
Thank you
All
so
right.
much,
Love you
Poppy.
guys.
Bye.
Good to see you.
Bye,
Yeah.
Poppy.
bye. Bye.